Hi, I'm Nicole Thomas, Hospital President at Baptist South. We've prepared this video update just for you, our medical staff. So please spend the next few minutes listening to the updates and learning how you can help us achieve our goals in 2021. The icons on the screen are our 5 strategic pillars that make up our focus areas. We have accomplishments and priorities in each of them, and I've invited Dr. David Rice, Chief Medical and Quality Officer, and Dr. Jeremy Wood, Chief of Staff at Baptist South and Medical Director of our South ER, to discuss. Dr. Rice?
Thank you, Nicole. Congratulations, team, on delivering such outstanding quality care in 2020 while managing through the coronavirus pandemic. South outperformed its goals on preventing hospital-acquired infections for 2020. In fact, over the past 4 years, you've gone from having 118 infections in 2016 to just 26 infections in 2020. This is an amazing accomplishment. You've also outperformed the goal on readmissions, thanks to your diligence around ensuring follow-up care for patients with chronic conditions like congestive heart failure, COPD, and pneumonia. Please keep up the good work. Much of this year has been spent caring for patients through the pandemic. I can't say enough about how you stepped up when the COVID-19 pandemic hit Northeast Florida. South carried the bulk of the load early on and did so with excellence. You cared for 632 COVID admissions from March to November with, yes, some losses, but also many patient stories of recovery and success. Thank you for your help in relaunch, returning us to near normal volumes in record time. Our new normal will include caring for all patients who need us, whether they have COVID or not. Thank you for your commitment to patient care. Now let's keep it going in fiscal year 21. Dr. Jeremy Wood, Medical Director of the South Emergency Room and the Chief of Staff for South, is up next to share some of those priorities for fiscal year 21.
Thank you, Dr. Rice. I'm so proud of the care we deliver here at South. To continue elevating our clinical care, our focus for fiscal year 2021 will need to remain on infection prevention, reducing catheter-associated UTIs and central line infections through only using these high-risk devices when necessary, managing sepsis through evidence-based protocols, and ensuring care coordination for complex chronic conditions like AMI, CHF, COPD, and pneumonia to reduce admissions. We'll also need to focus on moving our patients efficiently through the hospital. We're in our busy season, so here are some tips. Attending physicians, enter pending discharges before 10 a.m. and/or discharge orders before noon. All support departments use the pending discharge list to prioritize their work, so this is really important. The entire team is working to get patients going home today out by 2 p.m. Consulting physicians, use the cleared for discharge order by consultant in Cerner. Please use this order in addition to your note as a way to clear patients. In the emergency department, we are focused on caring for every patient who presents to the ED, minimizing their wait to reduce the number of those who leave without being seen from the ER. Surgeons, please note that the 5-minute grace period that had been in effect for starting cases on time has been removed. The entire team will need to ensure first case patients are in the OR before or exactly at the scheduled start time. And finally, as competition moves into our service area, remember the best way to maintain patient loyalty is to show patients how much we care about them and their families. Treat these patients and families as you would want your family to be treated. Sit down while you visit with them, call a family member if they aren't there when you see the patient. Be sure you communicate what they should expect after surgery or procedure. I know that you have what it takes to keep delivering outstanding patient experiences. Now I'll turn it back to Mrs. Thomas to complete the fiscal year 2021 priorities review. Thank you.
Thanks, Dr. Rice and Dr. Wood, for your partnership to ensure Baptist South continues to be the hospital of choice for area residents. We plan to keep growing to meet the needs of our community. In December, we opened a 10-bed inpatient hospice unit on 7C. The unit is managed by Community Hospice and Palliative Care and is available for admission at this time. We're also building an outpatient imaging center in MOB3 to provide the convenient, accessible imaging option for our patients. This will shift some volume from the inpatient imaging fleet to provide capacity for our growing ED and inpatient volumes. Expect that to open in February. Our entire health system is preparing to move to Epic as our unified electronic medical record and billing system for patient care. Dr. Stacy Johnston is the program executive and will deliver updates as we move toward the go live in fall 2022. And we're also working to create a workplace where everyone feels like their voice is heard and they have a sense of belonging here at Baptist South. As medical staff leaders, you can help us by valuing the diversity of our teams, eliminating health disparities for patients, and creating a culture of inclusion for all. Thank you for doing your part to make this a great place to work and to receive care. We can't say thank you enough for all you're doing to care for patients here at Baptist South. Together, we will continue to exceed the expectations of our patients and our community. So stay connected with us. For regular updates, refer to the digital display boards throughout the facility, attend your department meetings, or reach out to the elected medical staff leaders or any hospital leader. We look forward to another productive year together. It's an honor to serve alongside you, and I look forward to what we'll do together in 2021.